Hey there YouTube, it's Nick with Feeding Fitness. I've been asked to do a video like this for a while and I didn't know the best way to approach the subject because it's a little bit touchy, but I'm going to go ahead and talk about training with a back injury. Lower back specifically. I'm talking like herniated discs, any issues with disc problems. You know, you hear words like herniation, bulge, slipped. For all intents and purposes, they're very similar. And I feel like I'm going to talk about this because I have this problem myself. But before I start, I need you guys to know I am not a doctor. I'm not licensed to treat or diagnose you with anything. This isn't really even advice you should take specifically without talking to a physician or some kind of physiotherapist or even a chiropractor. You want to talk to someone who's an expert in this. I'm no expert. I'm someone who's been through it, and I'm going to talk about my experience and what I did, but I saw a doctor, and you need to do the same thing. So don't substitute these videos for actual medical care. They're not intended for that. With that being said, this is going to take a couple of videos to get out, and I'm going to break it up into sections. First thing I'm going to talk about is my own personal injury and just some very basic things you can do to both prevent or first line treat any kind of a lower back injury. So let's start about my own injury. It's been, like a year and a half since my original lower back injury. And I can pinpoint the exact moment that it happened. This was no mystery. This was no, how did I hurt my back? I know sometimes people don't really even know what they did. Mine is very blatant. I was in the gym, I was deadlifting, and I put about 75 to 100 pounds more than what I could do on the bar, and I tried to lift it. Locked out the rep, and I've been paying for it ever since. I knew immediately after the lift was done something was wrong. I didn't even get pain, and I got worse than pain. Numbness. Numb. Completely in my lower back area, all the way down my left leg. Completely numb. That's not good. I stopped deadlifting there, didn't know the extent of the injury. Since everything was numb and I wasn't really in pain, I finished my workout. Also a big mistake. If you're fucking numb from doing workouts, stop. It's bad. Numbness and tingling, not good. Stop what you're doing, go home. But no, I, like an idiot, finished my workout. So, felt all right that day, went to bed the next morning, dear God. I was in some pain that I can't describe. It hurt to do everything. It hurt to lay down, it hurt to stand up, it hurt to be on my side, it hurt to walk. There was no good, comfortable position for me. Normally, when I get an injury like this, I have the mentality to give it a few days. Just rest. If it doesn't get better, get it checked out. I feel that's pretty reasonable. So that's what I did. Your gym is done for the week. Stop. Don't go back. Don't do anything. Don't do a light day. Don't do a cardio day. Take a week off. It will not ruin you. Also, will point out if you're cutting and you decide to take a week off, bump your calories to maintenance. Maintenance calories will help you. You don't want to be cutting when you're trying to heal, and if you're not lifting, you don't want to be worried about muscle loss. So bump your calories up to maintenance. Take a week off. It is not going to make a lick of difference. Now, a lot of times you can just strain your lower back, you can pull a muscle, whatever. Those tend to get better. They go away completely after a few days to a week. If that's the case, slowly reintroduce your training, I think you'll be fine. Me, didn't happen. It got worse. Days went by, got worse and worse. It was starting to affect my job, so I had to go see the doctor. Now the doctor did some tests, he took an x-ray, did not do an MRI for me. And most people with lower back injury probably should get an MRI, but here was his reasoning that I was okay with. You would get an MRI to have it read by a spinal surgeon or a neurosurgeon or an orthopedic surgeon. They can all do spinal surgery. And basically that MRI will diagnose exactly what you have wrong, if you have a herniation of a specific disc, this, that, or the other, and they'll use it to recommend surgery. Well, at my age, surgery is not a good option. I'm 29 years old. There's no way in the world I'm having back surgery unless literally I'm in pain every day for greater than 6 months. I'm obviously going to try therapy first, and I'm going to try and rehab. So getting the MRI wasn't crucial for me because no matter what it said, I was still going to try therapy and rehab. If things didn't get better and it looked like surgery was my only option, then it was time to get the MRI. So that was my doctor's line of thinking, and that made plenty of sense to me. And my doctor knows that I'm into weightlifting, and he knows it's a big part of my life, so he understands that. But he did recommend that I take a break, which is what I did. Took a break, and I started to do some basic things. Now, I'm not going to get into my exact rehab routine. I'll do that for another video. But what I will tell you, here are a couple of things that everybody can do, whether you have a lower back injury or not. This will help you prevent an injury, and this will help you from aggravating an injury. First things first, your posture, your sitting and standing posture. You will spend the majority of your day, other than when you're sleeping, you're probably sitting or standing in some manner. A lot of you stand like this. You're slouched. Your back is got a curve in it. You don't want to stand like this. You want to be straight. You want to have those normal curves in your spine. Your chest out. You don't want to slump. Same thing when you sit in a chair. Now, this is not a very ergonomic chair. There's probably better chairs, but when you sit down, you don't want to sit like this. If you work at a desk at a computer, not a good way to sit. If you're going to play video games, bad. If you're going to drive a car, bad. You spend a lot of your time sitting. You want to sit with a neutral spine. Again, this chair is not a very good chair. If you had to be sitting for lengthy periods of time, get yourself a good chair. This is not a chair I would spend a day sitting in. But if I have to sit in this chair for one reason or another, I'm going to support myself. And at first, this is going to be fatiguing because you're going to be using parts of your body you're not used to sit. And you're going to have to mentally think about sitting correctly all the time. It's going to take months, really, until you internalize it, and this is just the way you sit. Because you've probably been sitting like this for years. So to untrain your body and retrain yourself to sit like this is going to take a long time. But the way you sit and the way you stand is going to make a huge, huge difference. I also recommend that you get one of these. You can get them at Walmart. I think it was 10 bucks. It's a very good way to sit. It makes it much easier to sit with a neutral spine. For a long time, this was the only thing I felt comfortable sitting on. I would sit on this at home to watch TV, to work on the computer, whatever I was going to do. I'd sit on this ball. It was worth its weight in gold. I don't sit on it so much anymore because my back is feeling a lot better than it's ever felt, but one of these is very much worth the investment. So fixing your posture is something all of you should do. If you slump, when you drive, when you sit, when you stand, fix it. It's going to help you prevent a low back injury in the first place, and it will, it's just good for you. And if you have a back injury, this is going to help you make it better and rehab it a little bit. Okay, so that's all I want to specifically say in this video. I'll do another video on how I rehab, like the specific exercises I did just to improve my lower back health. And then I'll do a video on how I trained in the gym, how I altered my routine to accommodate for my lower back injury. If you have questions specifically related to training with a bad back, rehabbing a bad back, anything to do with herniated bulge disc, anything like that, please ask them in the description of, or in the comment section of this video so I can address them in the next couple of videos. I'll put this one up and then I'll probably make a few other videos on different topics before I make the next one in the series, so I have time to get your guys' questions and address them specifically. So if you have low back injury questions, put them down here and they'll get addressed in the video. So that's all I want to say for this video. Please share this video with friends that have lower back injuries. Again, I feel I must point out, I am not a doctor. You absolutely, positively must seek medical advice for treating a lower back injury. These are just some things that I did that worked for me that might help you out, but you need to talk to your doctor before you do any of it. And that's really it. Please like, favorite, subscribe the video. You can head over to our Facebook page at facebook.com/feedingfitness, and I'll see you guys next time.